I'm Dr. Kutesa Hilary. I'm a psychiatrist at Case Hospital. I am passionate about mental health. I'm passionate about mental health advocacy, educating masses about the plight of mental health in Uganda. So mental illness is any clinically significant disturbance in how someone feels, that is emotions or mood, in how someone thinks, or in how someone behaves. Okay? And we can know that this is either disturbing to the person, subjective distress, or it is objectively noticeable. For example, somebody is not able to work, somebody is not able to study, their social relations are disturbed. Okay? I think that's a fair enough definition. Yes. So we have different categories, but the broad ones are two. We have primary mental illness and secondary mental illnesses. The primary ones tend to be the ones we know not to be pointed to any cause that can be treated. The secondary ones are because there's something else causing it, something else that is treatable. For example, if you get an accident and you border, okay, your head gets, you bleed inside the head, subsequently you may develop depression. Okay? So that's secondary. But there's another group that the primary one, someone just develops depression. Okay? And we do every test and all the tests are coming out normal, but they're very depressed. Okay? So I hope that brings some distinction between these two categories. Yes. So the primary ones, we have found consistently that most of the primary causes of mental illnesses, most of them are linked to genetics, most of them. That if you dig into the family, somebody in that family has had a mental illness. Okay? Okay? The secondary ones are due to things that we find that happen, life happenings. You get HIV, for example. It's a common disease that causes a mental illness. You get HIV, and then you get manic symptoms. You get very excited, very happy, very energetic. Or you get, for example, a brain tumor. And you start believing, you know, you can pull the sun to the earth. And when someone does a scan, they say, oh, this is because there's a tumor. Okay? And you know, things like epilepsy. Some people who get epilepsy, depending on where the focus of the epileptic activity in the brain is, someone can have very, very bizarre behavior. Yes. So that's a quick summary of the causes, but there's a very, very long list. But it falls into those two categories. So we've talked mainly about the primary one, that's dominantly genetic, dominantly, and then we have the secondary ones, and I've listed a few of them for us. Head injury, very common cause. If somebody, as we in Uganda, most don't use helmets, most don't use seat belts. If you fly through that car at the speed at which it has been moving and you hit your head on something, it will be hurt. And as you recover, there are some brain complications that happen. Okay? Some of them are because somebody has had disease that directly affects the brain. So meningitis, cerebral malaria. You could have things like tumors. We talked about tumors. You could have things like epilepsy. You could have stroke. Very common cause of these mental illnesses as a complication. Someone gets a stroke, a couple of months down the road, they're feeling very depressed or very anxious. Okay. Other things could be when you find yourself in severe traumatic situations. People who have been at the war front, for example. Okay, people who have been persistently raped, for example. Repeated rape. It might even be one event, or it might be repeated, or torture. Okay, they can develop very severe forms of mental illness. Okay, yes. So we usually wouldn't want to make people very scared about their likelihood of getting mental illness. Okay, so the classifications of mental illness can be thought of in terms of either age-related or in terms of what the brain does. Okay, so that is mood, thought, cognitions, and behavior. Maybe we haven't really defined what these things are, but a mood is really how you feel, the dominant feeling you have. Your thoughts is planning, judgment, thinking, calculating stuff in your head. All that is in the realm of thinking. And then cognitions is mental processes that help you to remember stuff, to speak language, remembering the correct words at what time. That is cognition. We also have the other aspect, behavior. What is observable in how someone conducts themselves in response to their environment. Okay, so we could classify them, the mental disorders, in that way, but that's also very simplistic. So regarding development, we could start from childhood. We have neurodevelopmental disorders, and that's where we have autism, that's where we have attention deficit and hyperactivity disorder. Okay, that's where we have intellectual disability, what we have been calling here in Uganda, Mongo. That's childhood, among other disorders that fall in that category. And then we have what we call psychotic disorders. These are a more severe form, you know, and they are disorders characterized by very severe disorganization in behavior, disorganization in thinking, in how they perceive the world around them. And here we have schizophrenia, we have acute psychosis, here we have schizoaffective disorders, okay? And we also have mood disorders. Okay? Here we have diseases of feeling. Okay? Diseases of feeling. So anytime someone's mood is persistently in a particular state and it impairs how they relate with the world and with themselves, we want to be worried. Okay? So major depression falls in this category. Okay? We have bipolar disorder. Okay? And in bipolar disorder, someone swings between being very depressed and very excited. Okay? One moment, in one episode, they're the king of the world, they're very generous, they're giving out everything, you know, they want to save the world, sometimes they even become God or Jesus. And then in another episode, they're the most useless person in the world. Okay? Very, very challenging to be in any one of these episodes. And then we have trauma-related disorders. I'd earlier talked about people who are exposed to extreme situations. When you have been exposed to life-threatening events, war, rape, being at gunpoint, having a knife at your neck, being clobbered by people as you go home, for a particular group of people, this has an everlasting effect on their head. They keep reliving this event and it affects their life permanently. So this is where we have post-traumatic stress disorder and acute stress disorder. Okay? One of the other anxiety-related disorders, one of the other categories is anxiety-related disorders. This is where we have the phobias. So people who fear heights, people who fear spiders, people who fear snakes, cockroaches. And then we have people who fear being in public. They just cannot handle the pressure of being outside in the open space, okay? And then we have people who fear everything and anything. They will not move out because maybe the rain will hit them, and if the rain hits them, maybe, they just a million fears they have, and they can't control these fears, okay? Those are anxiety-related disorders. We also have another category, okay, that sometimes can be very confusing for the wananchi. We tend to call them dissociative disorders. But why they're very confusing is because of how they mimic possession states. Someone talks like they are someone else, and someone takes on another identity. And it is very, very distressing for the people around, or for the person themselves, to realize that I don't remember what I did between 10 a.m. and 2 p.m. the next day. And yet I'm told I did so many things that, and they were saying I was behaving like this other person. And it can be very challenging because a lot of things can happen in that episode, and people get sick, people get into accidents when something like this happens. We also have sleep disorders. Sleep disorders belong into mental disorders. People who can't sleep, people who sleep too much, okay? Yes, if you go 12 hours, 13 hours, 14, you're just sleeping the whole day, there's a problem. If you can't sleep, initiate sleep, you struggle to initiate sleep, there's a problem. If you find the sleep being interrupted, there's a problem. Nightmares, repeated nightmares, there's a problem. You wake up screaming, shouting every night, something is not okay, okay? We also have another category which most people would shy to talk about, but sex-related disorders also belong among mental disorders, okay? It's amazing to learn that sex is dominantly in the mind before it becomes physical. So anything that affects the mind enough can affect sex, from arousal to the performance to the after the sex, okay? And we, in mental health, take sex as one of the vital signs. And people get uncomfortable talking about sex, but we talk about it a lot. If you're not able to enjoy sex, we usually find that there's something else. There's a stressor somewhere that is taking your mind away from relaxing enough to enjoy sex, okay? And I'd advocate everybody to check themselves once in a while. Am I really enjoying, or am I just being here, going through the motions, you know? Yes. We also have neurocognitive disorders. Now, this is for the older, okay, older people, but they can happen to younger people, but they're dominantly in the older people, okay? Significant forgetfulness, getting lost, being disoriented, calling places that are not the right places, forgetting family members, absolutely. And here we have, Parkinsonism, we have Alzheimer's dementia, we have vascular dementia, we have trauma-related dementia, and all these things can take the person's cognitions to sleep. They cannot remember themselves, even their own identity. That's towards the end of the course of the disease. And we also have something that is very disturbing, personality disorders. Personality disorders are characterized by lifelong difficulties in behavior, relating with people, okay? Relationship issues that may sometimes be easy to notice by other people, but the person themselves feels okay. But everybody else is complaining about this person because of a particular behavior trait or behavior traits that are very uncomfortable to be around, okay? Yes, there's so many other conditions that fall in these subsets, but these are some of the broad categories that we could talk about in a later time. Yeah. As earlier on highlighted, we have an interview, okay, with the patient. You could call it an interview, an assessment in a clinical setting, and we take history. And in this history, we're asking for the symptoms. What has been happening? How long has it been happening? Okay? How has it affected this person? Okay? And from that, we gather information that is related to any diagnostic criteria, depending on the history. And if somebody meets that criteria for a particular disorder and they have been impaired in their functioning, we say they have this disorder. Okay? That's usually how the diagnoses are made. In other settings, we can use tools, diagnostic tools. So I could give you a questionnaire, and then you feel, based on how you're feeling at that time, check. And then I'd go through that questionnaire, and from what you've answered, I can say you have this disorder or you do not. Okay? So those are the common ways we make the diagnosis.
Are there risk factors?
So risk factors, yes. So there's so many things that can cause us to be at risk, okay? But maybe I'd start from the beginning. Being alive. Being alive and having a brain, especially having a brain, is a risk factor for mental illness, okay? So once we have agreed that we are all at risk, then we now start to sieve out who is at higher risk for developing mental illness, okay? So we could start from childhood and go towards adulthood. If there has been malnutrition in any form, the mother being malnourished, okay, during pregnancy, after delivering, then the child is not fed well, these deficiencies have a very important impact on the brain development. And if the brain is not developing well at an early age, there's things that will be carried over into adulthood, and they'll be manifested in behavior disturbances. Okay? The other risk factors still in that period of time is mothers who use substances. Okay? If a mother is taking alcohol, we know that the child will be affected. They give birth to smaller babies. Smaller baby, even delivered at full term, but tiny, means even the brain is smaller, even the brain has been affected. And so it causes a ripple effect in behavior and nerve development, okay? But we also have other things that happen, like birth injury. When there has been birth injuries, child has been struggling to breathe. We usually will hear in our local setting, omwana akoye, okay, fetal distress. Labor has prolonged, or the mother had to, be, cut, baby had to be extracted. All those things have a way they affect the brain. These are very delicate times. A little deprivation of oxygen or an infection at a time like this can have a long-lasting effect on mental illness. Those things said, I do not want our mothers who have had difficult labor to get too anxious, because it doesn't happen to everyone. However, the risk is higher. Okay, that's the message I'm trying to drive home, that the risk is higher. Okay, and then when we get into childhood, we are growing up a bit, toddlers, still we can have the usual things: trauma, severe diseases, malaria, cerebral malaria, jaundice, those childhood infections. A child gets it now, and then they get locked at a particular area of development because it's significantly affected the brain and how it develops. Okay, so other risks spread go into now parenting. Okay, if there has been problematic parenting, absent parents. Okay, now this relates with the nurturing. The things we've been talking about are related more to biology, but now nurturing. If we have parents who are very, very abusive, physically, verbally, saying negative things to the children all the time when they're growing up, parents who are very, very physical in their discipline, extreme discipline, okay? Parents who are very strict, there's no room for no. Parents who are pushing their dreams onto their children for a persistent period of time. The child fails to develop their own identity, and sometimes this results into a very difficult teenager, into a very difficult mental health for an adult. Okay? And then we have the usual life stresses. You have a life event, death, a con man cons you of all your school fees. If you have been if you've been in very extreme suffering, just persistent suffering for a long time, you're not breaking out of the shackles of poverty. Poverty is a known risk factor for mental illness. Okay? For a very long time it was known. Mental illnesses are dominantly in slums and places of lower socioeconomic status. Okay? So we have to deal with poverty. The poverty eradication plan had better be quicker because it saves us from a lot. If poor people can't access quality education, they can't access quality healthcare, and so there is usually delays in most of the things, and ultimately something that would have been dealt with quickly, it becomes full blast disease. Okay? Yes. So risk factors, yes. So there's so many things that can cause us to be at risk. Okay? But maybe I'd start from the beginning. Being alive. Being alive and having a brain, especially having a brain, is a risk factor for mental illness. Okay? So once we have agreed that we are all at risk, then we now start to sieve out who is at higher risk for developing mental illness. Okay? So we could start from childhood and go towards adulthood. If there has been malnutrition in any form, the mother being malnourished, okay, during pregnancy, after delivering, then the child is not fed well, these deficiencies have a very important impact on the brain development. And if the brain is not developing well at an early age, there's things that will be carried over into adulthood, and they'll be manifested in behavior disturbances. Okay. The other risk factors still in that period of time is mothers who use substances. Okay. If a mother is taking alcohol, we know that the child will be affected. They give birth to smaller babies. Smaller baby, even delivered at full term, but tiny, means even the brain is smaller, even the brain has been affected. And so it causes a ripple effect in behavior and nerve development, okay? But we also have other things that happen, like birth injury. When there has been birth injuries, child has been struggling to breathe. We usually will hear in our local setting, omwana akoye, okay? Fetal distress. Labor has prolonged, or the mother had to, be, cut, baby had to be extracted. All those things have a way they affect the brain. These are very delicate times. A little deprivation of oxygen or an infection at a time like this can have a long-lasting effect on mental illness. Those things said, I do not want our mothers who have had difficult labor to get too anxious, because it doesn't happen to everyone. However, the risk is higher. Okay, that's the message I'm trying to drive home, that the risk is higher. Okay, and then when we get into childhood, we are growing up a bit, toddlers, still we can have the usual things: trauma, severe diseases, malaria, cerebral malaria, jaundice, those childhood infections. A child gets it now, and then they get locked at a particular area of development because it's significantly affected the brain and how it develops. Okay, so other risks spread go into now parenting. Okay, if there has been problematic parenting, absent parents. Okay, now this relates with the nurturing. The things we've been talking about are related more to biology, but now nurturing. If we have parents who are very, very abusive, physically, verbally, saying negative things to the children all the time when they're growing up, parents who are very, very physical in their discipline, extreme discipline, okay? Parents who are very strict, there's no room for no. Parents who are pushing their dreams onto their children for a persistent period of time. The child fails to develop their own identity, and sometimes this results into a very difficult teenager, into a very difficult mental health for an adult, okay? And then we have the usual life stresses. You have a life event, death, a con man cons you of all your school fees. If you have been, if you've been in very extreme suffering, just persistent suffering for a long time, you're not breaking out of the shackles of poverty. Poverty is a known risk factor for mental illness, okay? For a very long time it was known. Mental illnesses are dominantly in slums and places of lower socioeconomic status, okay? So we have to deal with poverty. Yeah, poverty eradication plan had better be quicker because it saves us from a lot. If poor people can't access quality education, they can't access quality healthcare, and so there's usually delays in most of the things, and ultimately something that would have been dealt with quickly, it becomes full blast disease. Okay? Yes. That is becoming very difficult to tell these days. Why? There has been an upsurge of diseases caused by substances, mental illnesses caused by using substances, that those substance-related mental illnesses are starting to outnumber the primary mental illnesses as we know them, the schizophrenias and the bipolars. Okay? Almost everybody who comes with the psychosis, when you dig up, they've been smoking weed. When you dig up properly, they've been taking alcohol, binging almost every day. You know, for now, I tell you, it's very alarming, but it seems like substance use disorders are really outcompeting the primary mental illnesses like bipolar and schizophrenia and major depression. However, population-wide studies will tell you that the commonest that almost someone will have at one point T is major depression. At some point T in everyone's life, they may have an episode of depression. Most of them heal spontaneously. Most of them, they just go through the dip and they normalize. But most times, there's a 25 to 50% chance that someone will have a depressive episode at one time. It doesn't have to be the worst episode, but they'll feel depressed. And it still contributes to the majority of debility, people not being able to work, not being able to fulfill their tasks at home. So statistically speaking, major depression is still leading. And then the others fall in place. Yeah. Mental illnesses are preventable, very preventable. And if we look through the list of the risk factors we talked about, we start with planned pregnancy. Well, I'll tell you for a fact, most Ugandans are unplanned. Most Ugandans born are unplanned, and we have come to accept how it goes, but that doesn't go without repercussions. An unwanted child is a child who is potentially going to be troubled because they've been rejected from the first day. The pregnancy has been rejected, and where the pregnancy has been rejected, there is potential for violence. There's potential for neglecting the nutrition of the mother. But also when a mother is persistently stressed, not knowing what is going to happen to them, that effect on their body, the elevated stress hormones circulating through their body, will have an effect on the child. This has been studied and documented, that any mother who is persistently stressed, when the child is born, years later, there are particular behavioral patterns that can be noted in the children born in that manner. So let's start with really thinking critically through our decisions when we are going to get pregnant. But also when we are pregnant, let us attend antenatal. There's so many things that can be picked up on in antenatal. We shall know that, hey, your blood is little. Oh, you have this particular other disease. You know, you have a disease that can be transmissible from mother to child. Should this disease reach the child, we may have neurological problems, you know, and ultimately behavioral problems. So attend antenatal as faithfully as you can. Eat well when pregnant, okay? Keep away from alcohol. Keep away from substances when pregnant. Those substances do have an effect on the unborn child, okay? As much as you can, keep away from anything that is likely to harm the baby, okay? We've talked of good nutrition for the mother, okay? If the mother is feeding well, the chances of giving birth to a healthy baby also improve, okay? And then when it comes to delivery, birth injuries can usually be avoided when we have been attending antenatal and we have a planned delivery mode. You've been seeing your doctor, you've been seeing your midwife, trained midwife. Many Ugandans have been lucky being delivered by traditional birth attendants, but we sometimes get trouble at the traditional birth attendant because they have sometimes given a mumbwa, something that forces uterine contractions when the cervix is not fully open. And then we get birth-related trouble. By the time they get to a hospital, the doctors are struggling to save either mother or child. Okay? If the mother, survives, the child has problems. Okay? So this area is very, very critical. Pre-pregnancy, pregnancy, delivery, and then we come to early childhood. Okay? If we can determine to feed our children well, we'll throw away lots of these diseases. Breastfeed. The recommended time has been studied, 6 months, exclusive. Okay? And then introduce other feeds gradually as recommended by the doctors. Once the children are eating well, they will grow well. A stimulating environment. Children's brains grow well when they're stimulated. Okay? Have the child play. Play, learn while playing, everything playing, play. The child learns to manipulate things and their brain grows much better. They learn language when they're in a group. They can learn 3 languages in that 3 to 6 years. A child can master 3 languages in such a short period of time, given the exposure. So let's not be too restrictive. Let us allow the children to be exposed. But let's also protect our children from trauma. Okay? And we've seen viral videos of, children being beaten in all manner of ways, children who can't fight back. Okay? When we can, let's protect them. Most times, we have heard of cases of rape or defilement, rather. It is done by relatives, people who stay at home, people who the child knows. Okay? Let us protect our children. These things have a ripple long-term effect on the mental health. Okay? Adults come and they're telling you the event happened when I was 5, 6, and the event is holding a 30-year-old woman. They have not moved on from that event. Okay? So let us protect our children as much as we can. Okay? And then build resilience in yourself. Okay? Speak to people. Increase your social circles. Okay? Learn from other people. You're not the alpha and omega of problem solving. Okay? Sometimes your solutions are the weakest. You're not going to be able to solve everything. So realize that you need help. And the sooner you realize that you need help, go for the help. Talk to someone before it gets overwhelming. This concept of I keep things to myself. Yes, ultimately you're dealing with a pressure cooker. Keep keeping them in until they will come out. The problem is they come out in a very messy way. Okay? They come out in a very explosive way, and usually it is difficult to control them once they come out. They come out with lots of crying, lots of fear, lots of they're very dramatic outcomes after having. Okay, so when you can, please make sure you are talking to somebody. Do not allow things to pile. Do not allow things to pile. Okay? Exercise. People who do exercise regularly tend to have better mood. It's that simple. Better moods for people who exercise regularly. So get an exercise routine. Okay? Eat well. Eat a balanced diet. Respect your sleep hours. Anybody who disrespects their sleep long enough is asking for trouble. Okay? Disrespect your sleep, and today you sleep at 10, tomorrow you sleep at 5 a.m. Do the 5 a.m. for 4 days, then you go sleep at midnight, then just keep playing around with it, and soon you'll develop a sleep problem. And you'll want the sleep to be stable, and it will refuse to be stable for years. Okay? So respect sleep time. Okay? Once we are sleeping well, the brain heals. Sometimes the trouble that we've had during the day gets resolved once you sleep on it. Okay? The other thing that can help us to keep to preventive, to prevent mental illness is having a regular person you account to. Okay, having an accountability partner. Okay, I did this, 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 I did this. Okay, it doesn't hurt. You do not lose anything by having a person like that. Be vulnerable to someone. That's what I'm saying. Most challenges come from being a very strong character. I can't be seen to be weak. I cannot be seen to be weak. Eh? That macho attitude has broken very many people down. Okay? So, allow yourself to be vulnerable every once in a while. You will not die by being a little vulnerable. So we have learned a lot about mental health, and if there's something that you probably haven't appreciated very well, is that we are all at risk of having a mental health problem at one point in our lives. And by virtue of that, we have to be very, very careful with our mental health. We have to take care of it. And part of the ways we can take care of our mental health is by ensuring that we are healthy ourselves. Okay? We eat well, we sleep well, we encourage healthy social relations. Okay? We build resilience. We are preventing economic deprivation. We are fighting poverty. We are fighting domestic violence. And if you do these things, you are a step closer to being free of markedly reducing the risk of having a mental health problem. If you do not have good mental health, you cannot be called healthy. And of course, if you're not healthy, you cannot be wealthy, because there is no wealth without mental health. Okay? And I'd like us to get out of here with that message very clear in our minds. Take care of your mental health. If you're feeling unwell in any of the ways that we have listed, please visit. We have a fully fledged facility at Case Hospital. We attend to mental health problems, all sorts of them that can come. We have an in-house psychologist, we have 2 psychiatrists on board, and we shall attend to your problems. We admit, okay, and we give treatment. We have an outpatient clinic, and we will help you go through with the mental health challenges that you might face. Okay? Please follow us on our Twitter, on our YouTube, on our Facebook and Instagram pages. Like, share, subscribe.